Hi, everyone, and welcome to another episode of Enjoy the Life You're Living. I'm your host, Jana Rieger, and my guest today is Christina Kang Rosow. Christina is a medical speech language pathologist with specialty training at the Massachusetts General Hospital Center for Laryngeal Surgery and Voice Rehabilitation, followed by a clinical fellowship at the University of Kentucky under the tutelage of doctors Joe Stemple and Rita Patel. In 2012, Christina was recruited to the Mayo Clinic, Arizona, where she worked until 2020, when she left to start her own private practice, the Voice Forum. In 2015, Christina proposed a new type of swallowing disorder that previously went undiagnosed, which we now know to be called muscle tension dysphagia. And her 3 peer-reviewed published recommendations for treating this disorder are now widely adopted. So join me now for a great conversation with Christina. All right. Hi, everyone. I'm Jana Rieger, the host of Enjoy the Life You're Living podcast. And I'm really excited today to have my guest, Christina Kang Rosow, with us. I've been looking forward to this conversation for a long time because the topic is one that's really of interest to me, which is muscle tension dysphagia. So this is a topic really that's just starting to get some recognition and one that I really think we need to talk more about. So Christina, welcome today, and looking forward to all the expertise that you have and learning about that from you.
Thank you for having me today. It's very kind.
My pleasure, certainly. So what initially drew me to your work was a webinar that you were doing with Dr. David Lott and Dr. David Rosow. And you guys were talking about muscle tension dysphagia. So I'd love to learn more about how your journey on that whole pathway started, how you got interested in muscle tension dysphagia.
Wow. I never imagined I'd be doing dysphagia because my background is in music, opera,
Yeah.
and I became a speech language pathologist is because I got bitten by the voice therapy bug. When I was doing my master's in vocal performance, I had muscle tension dysphonia, and then but I mean, people can get muscle tension dysphonia for varying reasons. But back then, I was under a lot of stress, and
Mm,
then I did voice therapy, and I was told that I was cured, and I was like, "Hooray!" And I kept on with my life. But I went to grad school at MGH Institute of Health Professions, and middle of that, I had a lot of stress, and
mm,
then really bad reflux disease, and
mm,
so my throat sort of locked up. I had no voice, and I had real hard trouble swallowing. And back then, like I felt like there's a ball in my throat, but now I know it was a globus,
mm,
and it was just really relentless sensation of discomfort in the throat. Like I'm choking constantly, and you shouldn't have to think about whether you can swallow your saliva or not, or
mhm,
in the middle of the night because just you felt like there's something locked up in your throat and like you just can't swallow it away. Put your fingers inside your throat, just swab it, like trying to get it out, and what is going on in my throat, that kind of thing.
yeah.
And then I back then at MGH I had a voice pathology professor named Tara, and she was my therapist as well as my teacher. And with after I saw the ENT, we saw that my throat was very red, and then I had glottic insufficiency because I went from singing to no singing in a day because I was so busy with school. And
Yeah.
then a lot of voice disorders, things that I was studying about but didn't expect myself to go through, and that just kind of intrigued me even more. And then I started the journey of trying to understand muscle tension dysphonia, and so I just really started reading a lot about anxiety, like how muscles become tense and all that stuff. So it was already in the back of my mind as I was doing clinical fellowship at University of Kentucky. And Dr. Stemple is an amazing, amazing mentor, and he made me think a lot about the whole person, not the technique, you
Mm.
know. And I was extremely blessed that I learned so much from him and Dr. Rita Patel as well. She's in Indiana right now.
Mm.
Um, so after my fellowship, I got recruited to Mayo Clinic, and then with Dr. Lott, we started the voice program. It was one of a kind, really state of the art, and I was really proud to be part of that. And then because I'm an SLP, and they expect you to do certain things, I started to be asked to do swallowing, and
Yeah.
I had to do a modified barium swallow, and went through MBS IMP and just doing one after another. And after doing about 1,000, I started to notice a trend.
Hmm.
And there were a great number of people who had normal swallows on the exam.
Yeah.
And then they still complained that they couldn't swallow.
Yeah.
And many of them did see an ENT. And they were told, oh, there's no lumps or bumps, it's all in your head, goodbye. Isn't this sad?
Yeah.
Since few people would like see one ENT after another. Like we had about, I think, 6 ENTs in our department, and one person saw all of them, even head and neck cancer doctors. Yeah, that's really hard on their wallet and
Yeah.
their mind, and constantly being told that it's in their head, but it's not. And I understood that sensation because I went through that.
Yeah.
And as a student myself and as a patient, and how much I had to study to manage reflux. I
Yeah.
knew it wasn't just about, proton pump inhibitors, it was about lifestyle
Yeah.
and how I treat myself, you know, how anxiety plays into effect. And I grew up with a lot of depression and stress, having been an immigrant, and it wasn't easy growing up here.
Yeah.
And so just all of that started to click in for me little by little. Like it wasn't like a break, like some kaboom moment. It just made sense to me. Like each individual I met, I started to understand their story and why they might be having tension, because I could see that they're tense and they're holding their breath and their voice is really throaty. And if
Yeah.
they don't know that they're having muscle tension dysphonia, because voice is not their problem. In this country, frankly, everybody likes husky voice because they
Yeah.
think sexy and everything. And
That's
so
true.
I point out that, oh, you're having a voice problem. They're like, so I'm here
I
because
sound good.
I'm here for a swallowing problem. And
Yeah.
there's so many variables, they many of them did come from ENT. Most of them came from PCP, and they're GI doctors, and just see what's going on in there, and there's nothing wrong with them. Few
Yeah.
of them did have like issues where they were actually found to have like blockage in the lower esophagus and turned out to be cancer and things like that. So SLPs have really important role in understanding like the mouth to all the way down to the stomach pathology, right?
Right. Right.
So I learned a lot, but bottom line is, after doing all those swallow studies, I started seeing trend of people with significant stress and anxiety. And if they weren't anxious, now they are. They
Mm,
have a problem with
because of the
that.
swallowing problem. Hmm.
Mhm. And then it's just constant. What do you call it? The ruminating.
Mm,
What did I do wrong? Like that little cup of tea I had, or could it eat ginger bad? Like constantly questioning everything in their life, it
yeah.
becomes a fun game.
Yeah.
Yeah. And so I got the IRB and then did a retrospective review of all the swallow studies. I went through all of them. I went through
Wow. A
all of them.
thousand studies.
Uh,
That's a big
not
commitment.
exactly 1,000, but it was close to it, But it
Yeah.
ultimately came down to where only like I forgot the numbers in the first study, but I think about around 60 were usable, because we could only use the ones where they had laryngoscopy,
Right.
and then laryngoscopy with like good imagery, like where they saw the laryngeal movement. And not every single one of them had stroboscopy, because stroboscopy is the only way to really see how the vocal folds close or move, right?
Yeah.
Laryngoscopy is you see gross movement of the larynx. You can't see the vocal fold vibration. So many factors involved there. And then bottom line is we had significant number of people, even 60 significant out of nearly 1,000. I'm gonna say 800.
Yeah.
Probably more closer to it. And many of them did do voice therapy, and I mean they all got better. And
Yeah.
that clicked in my head, and I said, I'm pretty sure I'm not the only person who noticed this. And in fact, there were many of my colleagues in other parts of the United States, worldwide, who were seeing similar things. Um, Dr. Lott and I just kind of one day was joking, God, this is muscle tension dysphagia. And
Yeah, it's
stuck.
stuck.
Yeah, because it really was. And
Yeah.
then Dr. Rosso is the one who coined the MTDG.
Yeah, yeah, I like that. So for people who are listening who wouldn't know about laryngoscopy and stroboscopy, why is that important? So what do you get from that that you don't get from a swallow study where you're doing an X-ray essentially?
Right. Well, with the swallow study, I mean, if you're doing fees, you can see some movement of gross movement of the larynx and whatnot. But if you're doing MBS, lateral frontal view of just bolus movement,
Yeah.
how much the swallowing structures are, engaging, not engaging, participating, how much of it looks balanced, coordinated, and it's all pretty subjective, right? Even though we do MBS IMP and like study it till the cows come home.
Yeah. Yeah.
Ultimately, it's about the art of the eyes, subjective. But with the laryngoscopy, you could put a camera through your nose and then, the flexible scope, and then you can see how the person is breathing, how sensitive the larynx is. A very, very sensitive larynx from like traumatic reflux disease and whatnot is not calm. It's constantly fluttering, and there's greater than 20% adductory motion, I mean abductory, opening abductory motion when they're just sitting there breathing, sensitivity, and also how much of the supraglottic structures, we call the false vocal folds and whatnot, how much of it is like engaging in at rest breathing, how much of them engage in phonation. When they phonate, you should still be able to see the entire vocal fold in length and see them vibrate, right? But many of them, with people with supraglottic tension, you can't see the vocal folds because false vocal folds like compress. Some of them are mediolateral, some of them are anteroposterior, but I kid you not, purse string. Some
Mm,
people engage in purse string.
mm.
That supraglottic compression, whether it's like circumferential squeezing of the throat or whatever fashion, you see that a lot in muscle tension dysphonia. That's
So
something that voice therapists are accustomed to seeing.
right. And so you're seeing all these things of like this voice box or larynx really closing down. What are some of the things that patients would tell you? What are their symptoms of muscle tension dysphagia?
It's hard to swallow, mainly solids, but I've heard it, saliva, water, um, literally everything. Most people just say, I'm having to think about swallowing,
Mm,
where I did not have to before.
mm,
So the description is going to be varied. Some people will say, I'm actually fine when I'm eating, but it's the saliva I can't swallow. So that's
mm,
going,
right.
okay. Because you swallow saliva, what, 800 times a day? So, and I guess when you're eating food, swallowing bolus, the brain has a signal like there's something going down, you better engage in swallowing, versus if it's just saliva, just kind of actively just contracting your throat, you just feel like it's hard to do that. So
Yeah,
I tell people, if you have a very clenched fist and you clenched even harder, it's just harder to clench that already clenched fist.
right.
So imagine your, pharyngeal constrictor muscles or whatever, all around your throat already kind of tight. And when you're trying to engage in swallowing, which is another act of constriction, I guess it's just harder to do that. You
Yeah.
know, I
Yeah.
I, I imagine a lot of scenarios where people will experience difficulties.
Yeah. And so, you were saying that there were some patients who have been around to each of your ENTs, like they're looking for answers. And how does this relate to some of the things that you hear about quality of life? How is that affected by muscle tension dysphagia?
Well, eating is a great joy for everybody, isn't it? Most people.
Yeah.
That's why it's so heartbreaking to see people with head and neck cancer, like, radiation, chemotherapy, just not being able to eat. And that's an extreme example, but where you really are forced to think about eating becoming like a burden for people. But for muscle tension dysphagia, people are generally just worried. It's like, it takes me longer to eat. I can't enjoy going out with friends or people, and I worry about what goes in my mouth, and I'm embarrassed about how long it takes me to eat. And I can't focus on, social aspects of eating because I'm constantly worried that I'm going to choke. It becomes a mental game.
I bet
Yes,
that when, when they're told like, "Hey, there's nothing wrong with you." Like, we did a swallow study, it looks fine. They're sent home. Is there an aspect of that's affected in their quality of life in that respect that they're being told that, "Hey, there's nothing wrong with you?"
of course. Oh my goodness. Yeah. Imagine if any part of the body where you feel pain and then you do testing and they're like, no, it's in your head, nothing wrong with you. That really it plays mind game.
Yeah.
There's worse words for that.
Yeah.
The self-blaming is also a huge burden on someone who's trying to live a fulfilling life.
Mhm, mhm, for
Yeah.
sure, for
So
sure.
I say the psychological aspect of this disorder is more the predominant in my observation.
Yeah. So let's talk, because that was really interesting in your webinar when you started talking about, okay, how do you treat this? And I think that probably one of the things that was really revealing in that webinar for me was you talked a lot about breathing. And I'm sure that a lot of our listeners don't know how interconnected like breathing and swallowing are. So if you wouldn't mind talking a bit about this whole aspect of that interconnection and then how you use that in therapy.
I think it was easier for me to describe the role of breathing for voice,
Mm-hmm.
because anybody can see that if they're holding their breath and trying to talk, something is not right, right?
Yeah.
And it's easier to describe. And but when I started to dive more into breathing because my training in chronic pain syndrome rehabilitation, and where they really really target breathing. Before that, I mean, I just knew breath work as something you need for a good voice. You need the breath power, circulatory pressure power to vibrate the vocal folds, and that was like the direction I was thinking about when I started to see how breath lack of breath awareness leads to general maintenance of stress and anxiety state. It made more sense to me. Now, some people need medication, some people need therapy, and then they can understand the benefits of breathing exercises and whatnot. I have seen people where you can teach all the breathing you want, but the anxious state, the brain has gone so far ahead in maintaining that anxiety state. There's nothing a conscious breathing exercise was going to help. They just needed medication and professional psychiatric help to calm that down, to even come to a frontal lobe understanding,
Mhm.
management of anxiety state. And so that's something I would really like to encourage people. Don't shy away from um, mental health care. But when it comes to swallowing, I tell people, if you are in a constant stress state, one of the physical aspects of that psychosomatic manifestation is shallow breathing, the chest high shoulder breathing, and their stomach is tight. And our society is already pretty bad on that. They're all stuck, stick in your stomach. I remember doing
Mhm.
ballet, and then like for the longest time, I didn't know how to let my gut out because I would be smacked with a ruler on my butt.
Right,
Because,
right.
right? Or like my best friend telling me, "Oh my gosh, your gut's hanging out, stuck in your stomach." That was even when I was in middle school. And so doing that, and I can remember so much about our society not promoting that relaxation breathing. And then anyway, so once you're starting to be mindful about the importance of like not carrying stress and anxiety to like not hold on to muscle tension, then the first thing that you notice is like breathing is labored,
Mhm.
breathing easy. And I try to teach people who are like disordered in breathing. Actually, Dr. Claudio Milstein from Cleveland Clinic actually once even coined the term muscle tension dyspnea.
Oh,
Yeah,
interesting.
yeah, the dyspnea. I'm like, ha. So when the breathing is disordered, you'll notice that so much about the body's movement and the use is thrown off course. And yeah, I for this, like I said, for dysphonia, you can hold your breath and try to talk, and you can sound really hoarse. And for dysphagia, try to do the similar thing. Try to kind of hold your breath and try to swallow. You can do it, but it's not easy. You know,
Mhm.
a nice relaxing exhalation, and then you let air come back into the body, and then swallow. Easy. So it's simple things like that people take for granted.
Right,
Yeah.
right,
But the way I see the swallowing and dyspnea is basically, are you relaxed? That's
right.
the direction I see.
Yeah, yeah.
If that makes sense.
And so when you're doing breathing techniques with people who have muscle tension dysphagia, do you find that is it easy for them to learn them? Is it hard? Are they even aware that their breathing's off?
Oh, it's varied. It's so varied. I say the breath work is the hardest. You know, it depends on their background too. There was a lady I saw for like 10 sessions, and every time she came back in, it was as if we never worked on it before.
Mm,
And people need to be like lying supine on their back, hands are on their belly, feeling it going up and down. They need a lot of imagery, just do it in lying, bent over, sitting, try everything. And there's some people who just have such a difficult time because they hold so much anxiety. Those
mhm,
are the I kind of think that they need counseling on the side to
mm,
work. But otherwise, most people tend to do well from doing the supine position, tactile feedback about their belly moving up and down, and a lot of progressive relaxation, like tensing up different parts of the body and letting go. And then like they become mindful that they can tense and release, that kind of thing.
mhm,
And some people are really good. They just get it. And I use meditation a lot. And
mm,
then in therapy session, we don't have a lot of time, so I can't do that. So I would recommend gurus like Rod Stryker, Sanctuary meditation app. I can't live without that.
mhm.
Great,
Nice.
yeah, great instruction. And uh, you know voice too. The meditation teachers, the use of voice and all that, it has to click with each individual. I personally like this male relaxing voice kind of. It helps me meditate, but there's so many out there. And
Yeah.
it's phenomenal, but I'm not talking about yoga that you do power yoga where you treat it like some workout. No, I'm talking about hatha yoga, just basic mindful breathing work. That kind of yoga is
Yeah.
what I. So apps, meditation apps, there are breathing apps, breathe to relax, and there's also a Cure. Is it called Cure? There's a chronic pain rehab app.
So there's a blend of having hands-on with a clinician, a blend of potentially needing to see a psychologist, a blend of technology that can help. If there are speech pathologists who want to know more about muscle tension dysphagia, what it is, how to treat it, what would you recommend? How do they get that kind of training or understanding?
Excellent question. So the three published papers talk about doing voice therapy. If they're utterly um what do you call it? Utterly intimidated by the idea of doing voice therapy, then start making connections and refer out to voice specialists and whatnot. But I've had people all over the world message me saying this worked, that worked, and a lot of them did manual therapy.
Mhm,
Back then uh, they call it massage, pressure point release, myofascial release, whatnot. And Walt Fritz, PT, R FRITZ, is a physical therapist who's specializing in swallowing and voice. Not
mm,
that teaching them how to do it, but he does manual therapy, and he
mm,
gives online courses. He does in-person seminars all over the world, and it's ASHA credit right there. And then he treats the whole person aspect. I really
mm,
do appreciate that. I have done his courses too, and I walk away from having an insight to seeing the whole person. And not just going in there and like rub, rub, rub. No, no. What else do I have to take into consideration? That's an excellent online or in-person training, and I do not make any money off of them.
Mm.
Yeah. But I like to tell people, don't think of this as a case. You
Mm,
know, look at the person and try to see the puzzle and where they're stuck. And
mm,
are they stuck mental, emotional? If it's physical, are they stuck in their breath? Are they like, are there things that you notice obviously like they're holding back? And it can start from there. And then there are people who've gotten so much better just by receiving the massage,
mm,
myofascial release and whatnot, or sessions really is the magic number. Whether
mhm,
it's
mhm,
for voice therapy or for muscle tension dysphagia, 4 session really um, really focused and targeted. It was proven by those research and my personal experiences, patient and by reports by other people, that 4 session was a magic number. If not, then they have to kind of step back and say what's not working. Look at where they're stuck,
yeah,
and don't get intimidated. Get to know the person, and sometimes there may be things that they're not telling you. It may not even be a muscle tension dysphagia. It could be a voice problem. And then when you have a voice problem, tight throat, you're going to have tightness in other aspects as well, swallowing and breathing.
yeah, yeah. Okay. So one thing that to wrap up our conversation, one of the questions that I'd like to ask all of my guests, Christina, is what does the phrase enjoy the life you're living mean to you?
I think it's being mindful and grateful for people who give you love and support.
Mm,
When I remember having to work for recognition and whatnot, and I felt like living like an island, but nobody's an island. We all help each other, even those people or situations where it didn't seem like it was helpful. It just seemed like they were just making my life hard. It was a learning experience for me so that I appreciate what I have now.
mm,
And we it's cliche to say, oh, love makes the world go round sometimes, because sometimes love is what causes problem. But I think if I can stay mindful of all that I have accomplished, but stay humble and um, just appreciate people that come in my way, things I've created, like my son and family and friends, and I think that is life that I'm living now, and that's something I can enjoy.
well, that's really wonderful. Thank you so much.